Marburg causes a severe hemorrhagic fever that impacts multiple organ systems and can include profuse bleeding, and affects both humans and non-human primates. Marburg virus disease is a highly virulent disease that causes hemorrhagic fever, with a fatality ratio of up to 88%. It is in the same family as the virus that causes Ebola virus disease. Marburg virus spread through human-to-human transmission. The incubation period for Marburg disease varies from 2 to 21 days. There are no vaccines or antiviral treatments approved to treat the virus. The West African country of Equatorial Guinea and Tanzania are facing their first known outbreaks of Marburg virus, which is in the same family of viruses as the Ebola virus. The UAE and GCC countries are advising travelers to avoid non-essential travel to a specific province in Equatorial Guinea and Tanzania due to the recent outbreak of the infectious virus. In Equatorial Guinea, there have been at least 9 laboratory-confirmed cases, 7 of which resulted in death, and 20 probable cases of dead individuals in this outbreak, according to the World Health Organization. There are no vaccines or antiviral treatments approved to treat the virus. However, supportive care, rehydration with oral or intravenous fluids, and treatment of specific symptoms, improve survival. A range of potential treatments, including blood products, immune therapies and drug therapies, as well as candidate vaccines with Phase 1 data are being evaluated. The outbreak of the hemorrhagic fever has spread beyond the province of Kintem, where it caused the first known deaths in January and reached Bata, the economic capital of the West African nation. Tanzania also announced last week 5 deaths from Marburg, but insisted it has the spread under control after sending a rapid response team to the northwestern region of Kagera, which borders Uganda. World Health Organization has warned of a potential large-scale epidemic which could spread to neighboring Gabon and Cameroon. There have been a dozen major Marburg outbreaks since 1967, mostly in southern and eastern Africa. Like Ebola, the Marburg virus originates in bats and spreads among humans through direct contact with the bodily fluids of infected people, surfaces and materials. The rare virus was first identified in 1967. Symptoms of Marburg disease. Illness caused by Marburg virus begins abruptly, with high fever, severe headache and severe malaise. Many patients develop severe hemorrhagic symptoms within 7 days. The virus is transmitted to people from fruit bats and spreads among humans through direct contact with the bodily fluids of infected people, surfaces and materials. Diagnosis of the virus. Clinically, Marburg virus can be difficult to distinguish from other infectious diseases like malaria, typhoid fever, shigellosis, meningitis, and other viral hemorrhagic fevers. The following diagnostic methods are used to confirm that symptoms are caused by Marburg virus infection. Antibody capture enzyme-linked immunosorbent assay, ELISA. Antigen capture detection tests. Serum neutralization test. Reverse transcriptase polymerase chain reaction, RT-PCR, assay. Electron microscopy. Virus isolation by cell culture. Patient samples pose an extreme biohazard risk. Laboratory testing on non-inactivated samples should be performed under the strictest biological containment conditions. When transported nationally and internationally, all biological specimens should be packaged using the triple packaging system. Treatments. There are no vaccines or antiviral treatments approved to treat the virus. However, supportive care, rehydration with oral or intravenous fluids, and treatment of specific symptoms, improve survival. A range of potential treatments, including blood products, immune therapies and drug therapies, as well as candidate vaccines with Phase 1 data are being evaluated. Incubation period. Within an incubation period of 2 to 21 days, infected individuals get fever, chills, headache, and myalgia, which is muscle pain.